Well, good morning, everyone, and thank you very much for joining us this morning. My name is, and thanks also for your patience. We have had we've been vastly oversubscribed for this session, so we thought we'd be able to accommodate more people by using the different platform for this. So we have been waiting for people to join from the other site. So we do thank you for your patience this morning. My name is Bob Quinn. I'm part of the GP Connect team at NHS Digital. I'm joined this morning by Michelle McDermott, who's going to be taking you through the presentation this morning, and we're going to be looking at how to manage appointments during the COVID-19 vaccination programme using EMIS Web. Before I hand you over to Michelle, I'd just like to go through a little bit of housekeeping. We've got everyone on mute. If you do have any questions, the best way to actually ask a question is by using the chat function, or you can put your hand up if you prefer to speak to us about that using the old-fashioned method. I think that's all really around housekeeping, so we'll get things underway. I'll pass you over to Michelle. Thank you, Michelle.
Hello everybody, thank you for sticking with us. Hopefully we've got most people over from the other link now. So as Bob said, we're going to talk a little bit about COVID-19 vaccinations, and specifically today using EMIS Web to book into a designated vaccine site. It's quite a simple process, but we'll take you through that process and then take any questions. So I'll start with a quick overview of the vaccination process. So in terms of what we need to do immediately, you'll already be identifying your eligible cohorts of patients and getting them invited in for appointments, and likely if you're in wave 1, you'll be starting that activity today and tomorrow. So you'll be working out the eligible cohort, and initially if you're on the Nikki Kanani webinar last night, we'll know that that's the over 80s who are able to come to the surgery, and then book those individuals in for appointments. So that's where GP Connect can help. So today we're focusing on the EMIS Web section of how to book your patients into those designated vaccine sites. Then you'll remind your individuals, patients, that they need to come in for their appointments, and the patient will then arrive at the designated vaccine site. That may be your practice, or it may be somewhere else within your primary care network. That site will then use the Pinnacle Outcomes for Health service to update the vaccination information. And the reason that Pinnacle is being used in that scenario is because it has the ability to update the registered practice with the coded information about the vaccine that was given. So the vaccine information is recorded in Pinnacle, and that's then fed back into the registered GP with no intervention required on the other end. And then there's a 15-minute period where, for those who are driving, they should be asked not to drive, just to make sure they don't have any adverse reactions to the vaccine. And then, of course, they're free to go after that point. Okay, so if we look specifically about how to book a patient in using your EMIS Web system, the first thing you need to do is make sure that you're set up to share the appointments that the designated vaccine site has made available. So there's two ways of doing this, and it will depend whether your designated vaccine site is EMIS Web or System 1. So first you need to go to the configuration from the EMIS ball, select the organisation configuration, and select organisation groups from the navigation pane, which is towards the bottom on the left-hand side. You've then got two scenarios. So the first one being that your designated vaccine site is also using EMIS Web. So in this situation, they will have already created an EMIS Web sharing group, and you just need to make sure you're subscribed to that sharing group. So for example, COVID-19, vaccination, Queenswood, and then the postcode, and you search for that organisation group and check that you as an EMIS Web organisation are subscribed to the group, which will then mean that when we do the next step of searching for appointments, you can find them. The other scenario is that your designated vaccine site is a System 1 site. And in that case, you need to create yourself an organisation group with you and the System 1 vaccine site in it. So same configuration steps here. go to organisation groups within the EMIS ball configuration, and then select a new group and add in yourselves and the designated vaccine site. That will then allow you to see the slots that they've shared with you. Okay, so the next thing is actually finding an appointment for that patient. So click on the EMIS button, go to appointments, and then select the appointment book, and then you get the appointment book screen displayed. On the ribbon, click Find Slot and then Find GP Connect Appointments. And the Find GP Connect Appointment screen is displayed as you can see. On here, beside the patient field, click on the magnifying glass and find the patient that you want to book in for an appointment. And then you'll get the option to add an organisation group. So it's mandatory that you include at least one organisation group in this field. So this is either the one that the EMIS Web designated site has created, or the one that you've just created with System 1. Put your organisation group in the search field, apply a date filter if you want to, and then the available appointments will automatically populate in the bottom half of the screen to show the slots that group is sharing with you. You can then select an appointment from the list that you want to book and select book appointment. You're only able to search for a maximum of 14 days. Now that doesn't mean you can't book the second appointment in 21 days time, just means that you need to apply 2 searches. So the maximum period of time you can search across is 14 days. So if I looked for an appointment that started today, the biggest number of time I could look for is 14 days from now. If I then wanted to book the second vaccine slot in, I'd just change the search parameters to look in 3 weeks' time. It's just that the maximum amount of appointment data that you can return is 2 weeks worth. So you'd apply the first search for the first vaccination appointment, and then you'd put different search dates in to get your second appointment booked. When you do click on the book appointment, the book slot screen is displayed. So you enter a description, which is mandatory, and a comment if you want to, and then click on book. And then you get the confirmation that the patient is booked in at a time with a duration and then the location of the practice that they've been booked into. Remembering, of course, that in this scenario, it's likely that the patient's going to be going somewhere for their vaccine that's not their usual practice. So if you need to change that patient's appointment or perhaps check that a certain patient has been booked in for their vaccination, you can view their booked appointments in EMIS Web as well. So to do this, you go to the EMIS button, click appointments, and then select the appointment book, and you get your appointment book screen displayed again. You can then use the ribbon to click on patient appointments and GP Connect patient appointments, and then you get the screen that I'm showing on the slides. Again, you have to look for an organisation group, so at least one is mandatory. So select the organisation group whose appointments you want to see, pop the patient's details in there, and then click search using the date filters. Now it will always default to today's date as the start, and it will then populate the screen with any future appointments or cancelled appointments. So you should then be able to see that patients booked in for 2 doses of the vaccine at certain dates. So that will allow you to check whether certain patients have been booked in, especially if you're concerned, or if you indeed need to go in and potentially change the appointment for the patient, you'd go in via this screen, and then you get an option to change the appointment as well. So a couple of things to remember. The patient needs to be booked into 2 appointments. A lot of the designated vaccine sites are operating a vaccine 1 and vaccine 2 type approach, so that it's obvious what you're booking the patients into. You can only search for a 2-week period at a time, so for the 2 different appointments you will need to do 2 different searches with the date filters. You might have disabled your text message reminders in the first wave of the pandemic. If you have, bear in mind to turn those back on, but configure them to the vaccine clinic. Wait for your designated vaccine site to confirm that they've set up their appointment slots before you try to book, otherwise you're going to get blank search results. And then all the sites in the PCN need to configure their system to be able to see appointments. So you have to do the first step where you either subscribe to the EMIS sharing group or you create a sharing group with System 1, otherwise it won't work. So make sure that you do that setup as a minimum. If you do want any further information, then the NHS England website is the source of all info, but we're also pushing out updates in the primary care bulletin. So do be sure to sign up for that if you haven't already. And then a couple more things from us. So we are providing recordings of the sessions and they will be available on YouTube today. We're also updating our GP Connect website and we're adding everybody to a Microsoft Teams site so that you can communicate with us directly and get your questions answered. We do have a Twitter if anybody wants to give us a follow. We're pushing information out on there as well. And just to say, if you don't want to be added to the Microsoft Teams site, please just let us know and we won't add you into that. But it is a good way of a direct connection in with our team. Okay, I will stop there and take any questions. Bob, do we have any in the chat function?
We do, Michelle. Sorry, I'm just having a look down the list here. So yeah, so Mark Diaz says, we have been told by our CCG today that nationally we have been told to use simple book system. Not sure what this system is, and to replace in-house systems. Does this mean we are wasting our time using EMIS to set up and book patients?
So I believe that the Simply Book system is a Northwest procured solution. It is there as an option, but you can use EMIS to set up your appointments if you want to. So it's really up to you. That it is a local solution rather than a national thing. Nationally, the webinar was very clear last night that the guidance is that you should use GP Connect to solve this problem, but I'm aware that Simply Book exists. So if you can choose to use Simply Book, you can also use GP Connect. You could use your EMIS to EMIS remote booking solution. It's really kind of your local choice. So whatever works for your PCN, and I guess in this context, whichever one you can achieve fastest.
Thank you, Michelle. We have a few other questions coming through as well. We have a question from Anonymous. If EMIS and GP Connect is to be used for appointment booking, will EMIS be available on the laptops that are provided by NHSE? Only one VPN token is being provided. Some of our locations are not in NHS buildings, etc.
Yeah, so the laptops provided by NHS England will have the clinical systems on them. So yes, if you're using EMIS or indeed System 1 to run your appointment book from that non-GP location, then yes, you will be able to use the NHSE provided laptops to do that.
Thank you, Michelle. Another question, is there no actual appointment list anywhere just to view?
There is if you're the designated vaccine site. So for the designated site, what you do is you set up a session or a rota in the same way you would for any session or rota. But as the booking practices, you can only search, certainly from an EMIS Web perspective, when you look for a patient and then you can see available appointments. You can't just look directly into their appointment book, although you are seeing a view of it, it's a view of it rather than the whole list.
Thank you, Michelle. Andrew asks, I have tried to book a test I have tried to book a test patient for the COVID clinic at our designated PCN site. I can see the appointments. However, when I highlight the slot and press book appointment, I get a box appearing saying you cannot complete this task because the GP Connect service is not available. Try again later or contact EMIS Health Support. Is GP Connect not working this morning, or is this a configuration issue?
So it is working. We are aware of this error, and it's happening where EMIS sites are trying to book into EMIS designated sites. EMIS are looking at it, and actually if you could drop us a note of your site details, then we'll add it adds a bit more weight that there's another site experiencing this same quirk, but we do have EMIS looking at it, and we will sort it. I think Andy's replying to you now to get your site details.
Thank you, Michelle. Another question, practices within our hub can also see NHS 111 and CCAS appointments. Is there any way to hide these?
Yep, so when you set up your when you do the setup for appointments, you should be applying a filter. It's likely that when you set up your 111 and CCAS appointments, you didn't apply a filter, which is why everyone can see them. So you need to edit the configuration for those. But if you drop us a line of where you're based, then we'll get our implementation manager to help.
Thank you. Question via Daniel, when does this go live? When does the C19 sessions need to be put on? Do the sessions need to be added for each day, like the CCAS 111?
So if you're in wave 1, then you'll start to get your vaccination deliveries Monday and Tuesday next week, and you need to start vaccinating from Tuesday if you get that delivery on Monday. And the vaccine only has a short shelf life, so the key bit is not to waste doses. I think because you're asking me when it goes live, you're probably not in wave 1. I believe that the following waves were being confirmed yesterday and today, and then we should have some timescales for vaccine delivery of those. In terms of sessions being put on daily, that really depends on how many patients and how many appointments you're going to be able to manage across the days. So you don't have to put them on each day. You could set them all up now for the next 3 weeks if you wanted to. I think, people have chosen to do a daily ad for 111 so that 111 don't book up all their slots in advance. But this is a slightly different ask. So you could set them all up in advance and not have to keep revisiting on a daily basis.
Thank you, Michelle. We have quite a number of questions coming through. Next one up we have is, we can't see GP Connect appointment choice when we click on find slot. Can we have some advice, please?
So it's likely that no appointments have been shared with you yet. It might just be that your designated site have not set up. But if you want to drop us your details, we can have a look at that and check whether any appointments have been slot up and make sure that there's not a problem.
That's great, Michelle. Rob Barnett asks, will there be a national booking system? If so, when?
So there is a national booking system, but not for the primary care model. So the national booking system that has been created will support the mass vaccine centres and the trust vaccinations, but it won't support the primary care network model. This is the recommended approach.
Thank you. Next question we have is, if we are already set up connected care for PCN, can that be used directly, or do we need any new specification?
So I'm assuming that you mean you're already using your primary care network sites to manage appointments across the board, and if you are, you can continue in that vein. If you did mean something else, then perhaps send us a clarification, because I'm not exactly sure what you mean by new specification. You certainly don't need any new data sharing documentation, etc., because we've enabled national sharing to support the COVID pandemic.
Thanks, Michelle. We have a question around a mixed economy here. A number of our PCNs work on both EMIS and System 1. As a federation who are hosting the vaccination, will we need to set up GP Connect on both systems?
So it depends where the federation are working from. So if the federation are working across multiple sites to deliver the vaccine in multiple sites, then yes, you'll need to set up appointments in multiple places. If you're working out of one site that everyone else will be able to see, then you'll just set it up once. It will depend on your exact configuration, but the PCNs working on both EMIS and System 1 is exactly what GP Connect was designed to support.
Okay, Catherine Henderson, yesterday there were conflicting messages in the webinars about online booking. Please can you confirm if GP Connect slots can be booked online by patients?
No, they can't. So I certainly don't think we were conflicting. GP Connect does not support patient-facing services, and you cannot book. If you're a patient, you cannot use GP Connect to book. So the NHS England advice is that you write out to patients and you invite them to appointments, so you don't leave it to patients because of the sheer complexity of the information you need to give them, the fact they need 2 slots in a certain time frame, and actually the first cohort are not likely to be those patients who want to engage in digital services anyway. So no, GP Connect does not support patient-facing services, but that's in line with the NHS England guidance that you are responsible for call recall.
Thanks for the clarification on that one, Michelle. Paul Friend, I think, has an issue at the moment with setting up things on EMIS. I think, Paul, if you can leave your contact details, one of the team can certainly get back to you to seek a resolution to that problem. Julie Allison asks, if we are EMIS host surgery and TPP need to check their appointments on our system, will they have the same access as EMIS appointment finder options?
So System 1 have a similar thing that they can view booked appointments. So the screen I just showed you in EMIS, where you can see the appointments that the patient's been booked into, you can see the same equivalent in System 1.
Thank you. For a question around how many minutes per appointment are recommended, or is this practice choice?
Yeah, it's entirely up to you. I mean, initially you might want to start being a bit longer because getting to grips with the Pinnacle system might be a bit slower than your existing practices, but maybe base it on the flu clinics that you usually run.
Thanks, Michelle. I have another question. We don't see an organisation group to subscribe to, but each practice in the county uses EMIS, as to my knowledge, does the designated site. When should we see this?
They'll need to have told you what the group's called to make sure you can subscribe to it. So it may just be that they haven't set up their appointment slots yet. It's probably worth contacting your designated site and finding out how they've set up their slots and what the group's called, so that you can make sure that you are subscribed.
Michelle, someone's asking for information how to set up this as a designated site. Again, if you can leave contact details, we can get that information to you. Let me just have a look at what some more questions coming in. A question about time between appointments, which I think has been addressed. Further question, Michelle, if each practice in our network is inviting their own patients and vaccinating their own patients in the PCN site, can we book in our own EMIS without the need to use GP Connect? We don't need to book cross-organisation.
So if you're all vaccinating your own patients in your own registered practice, then no, you don't need to use GP Connect. You can just book them into the registered practice like you always have done. But if you're all booking them, if you're all vaccinating centrally in one central PCN site, then you do need to use GP Connect, because when the patient arrives, it otherwise won't be visible on a central appointment booking system. Hopefully that makes sense.
Okay. I have a further question via Brian Hahn. How is this linking with the National Call-in Book?
It's not. So the National Call Recall Service is largely supporting the mass vaccine sites and the trusts, but there may be patients who get 2 communications, one from yourselves, one from National Call Recall, and end up being vaccinated in a PCN. The notion is that 2 invitations is better than none. So there is a National Call Recall Service, but it's largely focused on getting those patients into trust and mass vaccine sites, and certainly the first cohort are more likely to be comfortable coming to their registered practice. So they may receive more than 1 communication to say they need a vaccine, but that's not necessarily negative. And Brian has another question. We are not confirmed wave 3. How are we meant to invite in? I'm not sure Brian, but I'll pick that up with you afterwards if that's okay.
Grace M asked, does there have to be one single GP Connect bookable list, or can there be multiple bookable lists across different practices?
No, so you can have multiple lists. So some of the PCNs might be running more than one vaccine site, in which case you all set up as a designated site and share your appointments across the board. So you can have multiple lists, you can have multiple days. I know some practices have got 5 vaccinators per day, so they're setting up 5 sessions. And then when you look for an appointment, you've got, you know, vaccinators 1 to 5 to be able to book into. So yes, you can have multiple lists and probably will need to cope with the demand.
Thank you. Brian also asked, how do we book in non-registered patient who comes to us?
So Brian, I think probably I need to catch up with you afterwards because you clearly have a lot of questions. In terms of patients who are not registered at the vaccine site, they're likely to be registered within the PCN, so you can book them from their registered practice into the vaccine site. If you're talking about something different, then there's probably a slightly different process, but let's catch up afterwards and I'll talk to you about the various questions.
Thank you, Michelle. Still getting a few questions coming in. How can you identify the designated vaccine site within the PCN?
So you should have agreed that as part of your enhanced service submission. You may not have agreed that yet if you're not in the designated. Sorry, if you're not in wave 1. But there is an agreement generally within the PCN of who's going to be the designated vaccine site, and then you'll all know that as a network. So if not, perhaps you just haven't decided that yet.
We also have a question about Pinnacle software. Does the Pinnacle software need to be set up with individual practice to enable them to extract information?
No, so Pinnacle's just set up at the vaccination site with some user accounts, and it then uses the NHS Mesh service to send the information back to the registered practice using the patient demographics information which holds the patient's registered surgery. So it will send you back the information about the vaccination given. Elements of that message are coded, so they'll flow straight into the GP record and update automatically without intervention. And you'll also receive a full transcript of the consultation that occurred with the patient when they were vaccinated.
Thanks, Michelle. Julie Allison asks, how do we change the location in our text reminders?
I don't have specific instructions, but I will get back to you, Julie.
We have a question about if all the practices in the PCN all use EMIS, can we book appointments through cross-organisational bookings like we currently do with increased access?
Yep, you can do. If you're already using cross-organisational booking, you might want to carry on. You can also use GP Connect if you've not set that up already. But if you're all EMIS sites and you don't really have a need to add in a System 1 site, then you can just carry on with the cross-organisational booking.
Thanks, Michelle. Ivan asks, when using connected care for booking for member practices, how easy is it to check patient medical records if we need to review medical records?
I'm not familiar with what connected care is and whether that's a specific system, but the way that your clinical systems work, if you get a patient who's booked in who isn't registered to you, you can view their patient record. So it shouldn't really prevent you from viewing their record in any case, because you can search for the patient using their NHS number and find that patient record regardless of whether they're your registered patient or not.
I think that's, hold on, we have another question here. If we do not have a confirmed site, how do we search for the organisation group?
You can't. So you can't book into appointments until the confirmed site have set up their appointments to share. So that's the first step. The designated vaccine site has to have been chosen, and they have to then share their appointments for your patients to be vaccinated. Once they've done that step, then you can book into those appointments and find that sharing group. But until they have been identified as a designated site and then shared their appointments, there isn't anything you can do.
Thank you, Michelle. I have a question. Will Wave 3 run over the Christmas period, thinking of wastage of vaccines, etc.?
I'm not sure, because the dates haven't been confirmed yet, or if they have, I haven't seen them. They may, but I'd say that the rumour mill of Wave 3 is likely to be after the new year, but that's just what I understand at the moment. That's not been confirmed, so we're still waiting for dates on Waves 2 and 3.
Okay, and a further question. We are a small PCN with one designated site. Can we create appointment sessions in our own system and use organisation configuration switcher to log on to our own system?
I'm not familiar with organisation configuration switcher, but I think you could, if you think that works for you. You don't have to use GP Connect, but it is a solution. If you have another solution, then please carry on with that. You don't have to do something new if you already have something that works. It's just a lot of practices who don't. Thanks, Michelle. I'm not sure if you'll be able to answer this or have any insight to this, Michelle, but Daniel has asked, has a decision on the SNOMED codes to use for the first and second dose been clarified? EMIS Health aren't very good at updating practices in a timely manner. I don't know, but I will find out and let you know. Further question, can you have an EMIS appointment book where System 1 practices can book into using GP Connect? Yes, that's exactly what I've described today. So you, I've showed you how EMIS Web would book in today, but there's a webinar later this afternoon of how System 1 would book in. The whole point of GP Connect is that the system suppliers can book into each other's appointment books. Thanks, Michelle. Jodie asks, when booking a patient into another site, do we need to give a GDPR message stating info will be shared? I mean, probably you're telling the patient that they're going to another site. I don't think you need to do anything over and above that. I think Nikki and Ed were quite clear last night that, you know, implied consent when the patient arrives with their arm out is perfectly acceptable. So I would say patient agreeing to an appointment in another site is also implied consent, that they know they're going somewhere else beyond their registered practice. But if, you know, perhaps you could put something on the website or communications up in the practice, you can also tell patients if you want to. Jess asked, will there be training available for staff on the Pinnacle system prior to them using it? Yes. Thank you. Sorry, I'm just scrolling down to find the new questions. It's okay. Let's take a couple more, and then any we've not answered, we'll get back to people, and we'll let people get back on with their days. But we will answer everything and send the Q&As out, so we've made sure we've captured everything. Okay, there's lots of comments relating to other questions here. No, I think that's all of the questions. If we've, I guess our last opportunity, in case we've missed anything, to restate your question, please. Apologies if we've missed something. So we appear not to have any further questions, Michelle. Okay, perfect. Well, thank you all for your time. Thank you for managing to join the correct link. Hopefully it's been helpful. And as I say, we will get the information out to you, and we'll make sure that we get you all added to the Teams site so that you can see all of the content and ask us any questions as you need to. Okay, thank you very much, everybody.
Thanks everyone for joining us. Thank you very much indeed.
Thank you. Bye.